Good afternoon. I am Michele Monserratt-Ramos, and I am with Consumer Watchdog. In the past couple of years, I've developed a team of courageous families that actively participate in your meetings. I want you to see and hear the critical issues that need to be addressed and the changes that need to be made to make your enforcement system fair for all, from a variety of people from all across the state. I really think we're on the same page that we can acknowledge that your enforcement process is flawed. It is not fair for families, and there are rights that families and complainants should have in this process that we don't have now. We need a cultural shift in terms of the enforcement process. We can't just focus on the rehabilitation of the doctor over the welfare of the patient. When you continue to do this, the outcome is a growing number of repeat offenders that continue to harm patients, and more Californians die because there is no accountability. I know this from personal experience. The substance abusing doctor that was responsible for Lloyd's death harmed someone before Lloyd and harmed a minor child 1 month after Lloyd died. There were many more victims. Just like many of my team members, Lloyd's death complaint was closed at the Central Complaint Unit. We aren't asking for a lot. We are just calling on you to use the same complaint prioritization system that the osteopathic board must use and the nurses and other healthcare boards use. We realize that the system you use now is dictated by Business and Professions Code 2220.05 and 2220.08, but you know, and I know, that this can be changed. Make the system fair for all and adopt the same complaint prioritization system that other healthcare boards use. Making this change will require you to send our quality of care death complaints and serious bodily injury complaints to investigation. Adopt the same system that the other healthcare boards use. Make the enforcement process fair for all. Amend the Business and Professions codes and adopt the DCA complaint prioritization system. Regarding the board members' comments on this item, no, the families are not receiving the letters from the board. We are submitting complaints to the Department of Public Health, and when we receive statements of deficiencies, we're having a very difficult time getting the board to accept these additional investigative documents that support the family's complaints. The reason why we're submitting complaints to local health departments is because families do not have input into the process, so we have to find other methods to support their complaints. Thank you.